Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Dr. Olugbemisola Obi. She's the medical director for the NICU, or Neonatal Intensive Care Unit at MU Healthcare in Columbia. She says the hospital has seen some mothers lately who are very sick from COVID-19. So sick, in fact, that their babies are delivered preterm. She spoke about what it's like to work with these tiniest of infants, whose often unvaccinated parents are hospitalized or just testing positive for COVID-19. Here's Dr. Obi.
Just having a baby in a NICU is a challenge in itself. At the time of having a baby it's supposed to be a joyful time, right? The whole family is supposed to be there supporting this couple. But at times when it does not occur according to what that plan is, there's always a disruption. And we know for a fact, especially for our moms in the NICU, that mood disorders are quite frequent in baby, just for having a premature baby. Now you talk about a mom with COVID who is probably on the respirator, who is on lots of drips. And so a lot of times when they're delivered, the mothers aren't even aware. Maybe the decision was made to deliver while they're sedated on the respirator. So either the support person is having to make some of these very hard decisions. And so sometimes it can take about a week or two before they're even aware that they had a baby. Sometimes, it definitely disrupts that bonding that the mother should have. And then you have to also deal with the after effects when they do get better. There's a lot of guilt with the mothers, of not being there. And two, could they have exposed their babies to this? And a lot of times I hear those reports about how difficult it is for those families in adjusting because they weren't there from the beginning. As a NICU in itself, we are proponents of breastfeeding. Apart from being a treatment for some of our babies, it also emphasizes all the other things we've talked about, bonding. The other difficult thing is when the support person or the father of the baby also has an exposure and also comes down with COVID at the same time. Neither one of them can visit. It's very challenging sometimes for them to find an individual that they are trust who can come visit their baby. So they always wonder, oh, my baby's over there alone. And that's heart-wrenching for us too. But it's one of those things where, we have to ensure safety above all. Thankfully, the NICU nurse, they are very dedicated to what they do. If there's a baby in the NICU that doesn't have a visitor, they will take that job to heart, give the baby all the love they need, pending the time that the parents can come and visit. Ultimately, we see the mothers when they're getting better. We see the light that comes in their eyes when we're allowed to have them to do skin to skin for the first time. I think that in itself is a mood elevator. I think now one of the things that our OB colleagues have shared with us is that they are advocating vaccination through first, second, and third trimester of pregnancy. They've actually started recommending that to all their prenatal patients. Basically, MU is making the stand that we're going to recommend it because we see how sick our mothers are and how much of a stressor it is on the family as a whole.
That was Dr. Olugbemisola Obi with MU Healthcare, speaking about the impact that having a premature baby in the NICU, while also being COVID-19 positive, can have on a family. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.